Hello everybody and welcome to my TED Talk. My name is Jennifer Ricker. I am in Psychology 350 and my professor is Dr. D. So I'm going to talk to you about post-traumatic stress disorder and the effects in my life. I'm here today to talk to you about something that is very near and dear to my heart. It is post-traumatic stress disorder. Post-traumatic stress disorder, or PSD as we'll refer to it, affects so many people in our country. There are lots of people living with PTSD that is currently undiagnosed. They don't even know why they're having the feelings that they're having. According to the American Psychiatric Association, post-traumatic stress disorder happens when a person has a self-exposure or witnesses a traumatic event in their life. This can also happen when somebody is told about a traumatic event, like in a loved one or a friend or somebody that they know. Post-traumatic stress disorder is most often diagnosed in first responders, as well as military personnel, medical personnel. Even though it is more often seen in these groups of people, anybody from any race, any gender, any religion can be diagnosed with post-traumatic stress disorder. This is referred to as the hidden global epidemic. It does not discriminate. Historically, PTSD was not something that people had a diagnosis for or they knew how to treat. So, people usually help themselves by alcohol or sometimes even drug use. My father is a Vietnam veteran. He lost many friends to what we now know as post-traumatic stress disorder. Many times these veterans self-medicated with alcohol and they died from alcohol-related injuries or self-induced related injuries. My husband is an Operation Iraqi Freedom veteran as well as Operation Enduring Freedom veteran. Alcohol abuse is extremely common in his group of friends. Normal studies have shown that 63% of OIF and OEF veterans, as well as 73% of Vietnam veterans, have post-traumatic stress disorder. More research needs to be done for this group of people. Alcohol abuse is very prevalent. We need to have therapy for changing this behavior. There needs to be support groups. There needs to be one-on-one support groups and counseling sessions. There needs to be, in some cases, pharmaceutical drugs given to help these people cope. We need to have more done for our soldiers. That is where my passion lies. Now let's talk about our brain. Everybody has one. Mirror neurons give us the capacity for our empathy, how we feel. This is needed for valuable relationships. The bad side of having a lot of empathy and feeling for others is that it makes people prone to the negative effects. It makes you have more negative feelings. You're too sensitive. The interrelationship between your mind and your body doesn't function properly in the case of PTSD or even with a stroke that damages your brain. The stress hormones released take longer to get back to normal levels and even you out. Your limbic system is where your emotions are held. On top of the limbic system is also the neocortex, which is thicker in humans and is where your conscious and abstract thought is, according to Bauer. It was found that many people with PTSD have smaller than normal hippocampus and that these people suffer from PTSD more. I would like to implement that before our soldiers go off to war, they have a routine CT scan along with all of the injections that they get and all of the checks that they have to check and balance, make sure they're okay to go overseas. We need to do a CT scan. It is invasive. It can have non-contrast. It'll take 20 to 30 minutes depending on the scan and where it's going. And these soldiers need to be well informed and understand that they might have a higher risk depending on the size of their hippocampus in their brain. for suffering from PTSD. They need to be able to make informed decisions about being put on the front line and the risk of developing PTSD. There have been great strides with research. There is also a project called PTSD Brain Break that the VA is partnering with research facilities around the world. Different pharmaceutical drugs are known to be helpful in the treatment of PTSD. Antipsychotic drugs are helpful in the treatment of PTSD. They affect the dopamine and the neurotransmitters in the synapses and the neurons. So your synapses are like this, your neurotransmitters go back and forth in your neurons, and they can either block them or help them. My recommendation would be to provide more research on alcohol use with PTSD, have the CT scans for our soldiers. People need to be more self-aware of their own exposure and traumatic events with PTSD. This needs to be a community-wide and national-wide effort. Mental health used to have a stigma around it, a negative stigma. We are now more open as a culture and a society. We need to take mental breaks. We need to seek help if we feel different or notice somebody around us. Thank you all for coming to my TED Talk and listening to my ideas, as well as the science behind PTSD and how it affects your brain. There are people out there willing to help you and be on your team. So you're not alone. Thank you.